When providing care to patients with varied cultural backgrounds, it is imperative for the nurse to recognize that a. Cultural considerations must be put aside if basic needs are in jeopardy. b. Generalizations about the behavior of a particular group may be inaccurate. c. Current health standards should determine the acceptability of cultural practices. d. Similar reactions to stress will occur when individuals have the same cultural background. Answer B. Generalizations about the behavior of a particular group may be inaccurate. Rationale. Nurses need to determine how much an individual's life patterns are consistent with his or her heritage. To be effective in meeting various ethnic needs, the nurse should a. Treat all patients alike. b. Be aware of patients' cultural differences. c. Act as if he or she is comfortable with the patient's behavior. d. Avoid asking questions about the patient's cultural background. Answer B. Be aware of patients' cultural differences. Rationale. Caused by the changing demographic profile of the United States in relation to immigration and significant culturally diverse populations. A patient comes from a close-knit family. The patient's family functions as context. You will need to evaluate A. Attainment of patient needs. B. Family attainment of developmental tasks. C. Individual family members caring about one another. D. Family satisfaction with its new level of functioning. Answer A. Attainment of patient needs. Rationale. When you look at the family as context, you will want to remember that the primary focus is on the health and development of the individual members. You are caring for a patient. Visitors at the bedside include the patient's life partner, widowed father, brother, and niece. The nurse acknowledges that current trends in American families include A. Couples without children. B. More singles choosing to live alone. C. A very different look from 15 years ago. D. A mother, father, and more than one child. Answer C. A very different look from 15 years ago. Rationale. Although the institution of the family remains strong, the family itself is changing. A patient is diagnosed with gastroenteritis. The nurse finds that the patient is an unemployed immigrant and doesn't understand the language well. What should the nurse do to help this patient? Select all that apply. 1. Immediately searching job opening for the patient. 2. Speak directly to the interpreter. 3. Plan a visit to the patient's home. 4. Try to find a language translator for the patient to better communicate during the next session. 5. Referral to community service center. Answer 3. Plan a visit to the patient's home. 4. Try to find a language translator for the patient to better communicate during the next session. When completing the nursing data on a client, to complete the admission and develop a plan of care, the nurse will need to A. Test the family unit's ability to cope. B. Evaluate communication patterns. C. Identify family unit form and attitudes. D. Gather health data from all family members. Answer C. Identify family unit form and attitudes. A 35-year-old woman has Medicaid coverage for herself and 2 young children. She missed an appointment at the local health clinic to get an annual mammogram because she has no transportation. She gets the annual screening because her mother had breast cancer. Which of the following are social determinants of this woman's health? Select all that apply. A. Medical insurance. B. Annual screening. C. Mother's history of breast cancer. D. Lack of transportation. E. Woman's age. Answer A. Medical insurance. D. Lack of transportation. E. Woman's age. Rationale. The conditions in which people are born, grow, live, work, and age closely linked with social, economic, and/or environmental disadvantage. Which of the following is not included in evaluating the degree of heritage consistency in a patient? A. Gender. B. Culture. C. Ethnicity. D. Religion. Answer A. Gender rationale involves racial, ethnic, religious, and social groups. Which of the following teach-back methods could you use on a patient with limited health literacy? Select all that apply. A. Identify explanations and communication strategies your patient can understand. B. Provide the patient with a test to ensure they absorb the teaching. C. Ask open-ended questions. D. Use models, pictures, and handouts for teaching. You should always perform teach-back at the end of the assessment. Answer A. Identify explanations and communication strategies your patient can understand. C. Ask open-ended questions. D. Use models, pictures, and handouts for teaching. Rationale. Teach-back confirms patient understands teaching. Not B, because you just want to confirm clarity. Not E, because you want to use the chunk and check method. Which of the following are principles used when utilizing an interpreter? Select all that apply. A. Ensure that interpreter is competent in mid-term and understand issues of confidentiality and impartiality. B. Family members are okay if you can't get an interpreter right away. C. Make sure you speak to the interpreter. D. Use jokes to help ease the tension of having an interpreter in the room. E. Ask for feedback throughout the process to ensure that they are understanding. Answer A. Ensure that interpreter is competent in mid-term and understand issues of confidentiality and impartiality. E. Ask for feedback throughout the process to ensure that they are understanding. Rationale. Not B. You want to wait on the interpreter or find an employee who speaks the language. Not C. You want to make eye contact with a patient and have the interpreter stand slightly behind or at bedside of patient. Not D. Jokes are often lost in interpretation. The most important factor in providing nursing care to patients in a specific ethnic group is A. Communication. B. Time orientation. C. Biological variation. D. Environmental control. Answer A. Communication. Rationale, because different cultural groups have distinct linguistic and communication patterns. Which of the following is an example of a health disparity? Select all that apply. 1. A patient who has a homosexual sexual preference. 2. A patient unable to access primary care services. 3. Patients living with chronic disease. 4. A family who relies on public transportation. 5. A patient who has had a history of smoking for 10 years. Answer 2. A patient unable to access primary care services. 3. Patients living with chronic disease. 5. A patient who has had a history of smoking for 10 years. Rationale. Health disparities are differences in the incidence, prevalence, mortality, morbidity, burden of disease, and other adverse health conditions and outcomes among specific population groups. Examples: incidence rates for cervical cancer in Vietnamese women and U.S. prevalence of diabetes in African Americans and Hispanics, prevalence of melanoma in whites, cancer death rate for American Indians. During a nursing assessment, a patient displayed several behaviors. Which behavior suggests the patient may have a health literacy problem? A. Patient has difficulty completing a registration form at a medical office. B. Patient asks for written information about a health topic. C. Patient speaks Spanish as primary language. D. Patient states unfamiliarity with newly ordered medicine. Answer A. Patient has difficulty completing a registration form at a medical office. Healthcare organization must provide which of the following based on federal civil rights laws? Select all that apply. A. Provide language assistance services at all points of contact free of charge. B. Provide auxiliary aids and services, such as interpreters, note takers, and computer-aided transcription services. C. Use patients' family members to interpret difficult topics. D. Ensure that interpreters are competent in medical terminology. E. Provide language assistance to all patients who speak limited English or are deaf. Answer A. Provide language assistance services at all points of contact free of charge. B. Provide auxiliary aids and services, such as interpreters, note-takers, and computer-aided transcription services. D. Ensure that interpreters are competent in medical terminology. E. Provide language assistance to all patients who speak limited English or are deaf. Rationale. Linguistic competence. Provide language assistance resources. Inform all of the availability of language assistance. Ensure competence of those providing language assistance. Provide print, multimedia, materials in local languages. A nurse working in a large occupational health clinic knows that many of the workers at her company are marginalized and at risk for poor health outcomes. Which of the following individuals are most likely to be marginalized? A. Wives of the employees. B. The head supervisors of the company. C. Workers who have a high school education. D. Workers employed for less than a year at the company. Answer C. Workers who have a high school education. Rationale. Marginalized groups are gay, lesbian, bisexual, or transgender, people of color, people who are physically and/or mentally challenged, and people who are not college educated. A mother is concerned about her child's flu-like symptoms. You learn from the health assessment that the mother practices use of hot and cold foods to treat ailments. Which of the following foods do you expect the mother to use to treat her child? A. Chicken. B. Yogurt. C. Fresh fruits. D. Eggs. Answer D. Eggs. Which explanation provided by the nurse is the most accurate meaning for providing culturally congruent care? A. It fits the patient's valued life patterns and set of meanings. B. It is the same set of values as those of the healthcare team member providing daily care. C. It holds one's own way of life as superior to those of others. D. It redirects the patient to a more socially expected set of values. Answer A. It fits the patient's valued life patterns and set of meanings. Rationale. Transcultural care is culturally congruent when it fits a person's life patterns, values, and system of meaning. Which statement made by a new graduate nurse about the teach-back technique requires intervention and further instruction by the nurse preceptor? A. After teaching a patient how to use an inhaler, I need to use the teach-back technique to test my patient's technique. B. The teach-back technique is an ongoing process of asking patients for feedback. C. Using teach-back will help me identify explanations and communication strategies that my patients will most commonly understand. D. Using pictures, drawings, and models can enhance the effectiveness of the teach-back technique. Answer A. After teaching a patient how to use an inhaler, I need to use the teach-back technique to test my patient's technique. You are in the process of admitting an ethnically diverse patient. To plan culturally competent care, you will conduct a cultural assessment that includes A. Biocultural history, B. Ethnohistory, C. Negotiation, D. Ethnocentrism. Answer B. Ethnohistory. The first step during a nursing assessment is to A. Call the pharmacy to verify medications, B. Assess for language or communication barriers, C. Ask open-ended questions, D. Check for allergies on medical chart. B. Assess for language or communication barriers. Health disparities are unequal burdens of disease, morbidity, and mortality rates experienced by racial and ethnic groups. These disparities are often exacerbated by A. Bias, B. Stereotyping, C. Prejudice, D. All of the above. Answer D. All of the above.